the vision of Healthy Conversations was to bring health to life through advantage thinking. So we wanted to support foyers to improve their health and well-being offer. And we also wanted to empower young people to create their own health networks and develop their own healthy strategies, and to enable them to lead their own projects and tackle health inequalities and influencing decision makers in their local communities. We found that the young people in our network face a really wide range of health inequalities. Research has shown adults aged 16 to 24 eat less fruit and veg than any other age group. We found that 1 in 10 young people will experience a mental health problem, and that 61.3% of adults are obese. And this is a particular concern for young people experiencing unemployment, which obviously we have quite a lot of in this country. So you can actually read a bit more about the different health inequalities and policy areas that Healthy Conversations tackles on our programme evaluation, which will be available on our website. So our aim with Healthy Conversations was really to tackle these issues and lots more by taking positive asset-based approaches to health.
Okay, fab. And what did you do in the project?
So first of all, we worked with an organisation called Look Up to Yourself and a charity called Youth at Risk, and we trained staff how to use advantage thinking to coach young people to reach their health potential. So we worked with over 1,200 staff members over the 2 years, over 78 delivery sites, and those staff then went out and worked with more than 7,500 young people. They coached them to develop and, really importantly, to sustain their health goals and their own health goals that were related to their own general life plan, using positive goal setting. They also supported young people to grow their health networks through a variety of different health activities called taster events, and to grow their peer networks by engaging with each other through things called conversation groups. We also had a group of young health ambassadors who came to us through the Mental Health Foundation, and they worked with young people in peer-led group sessions. And then finally this all culminated at the end of each year when the young people led their own projects. And the idea was that they could use their learning, the skills that they learned through Healthy Conversations, to tackle a health inequality that was important to them. And those young people reached 9,000 people in their local communities, people like MPs, journalists, local commissioners, but also their friends and family, or quite a lot of just the general public as well, school children, people like that. So it was really wide-reaching.
Okay, that sounds great. And what did you find were your key challenges and successes?
Well, there's a lot of learning that came out of the programme. For example, we revamped our tools to make them more new user-friendly. We've got a really cool resource pack that's come out of that. We found that when you're working with such a large cohort of staff and young people, it can be really easy for individual voices to get lost. So we had to do quite a lot of work around staying in touch with our network and making sure we heard the stories of individuals. One of the things we did to help us with that was we put on staff training and training for young people as well. That actually gave them the tools to capture those stories, and you can see some of those on our website as well. We found that we exceeded 19 out of 20 of our programme targets, which we were really pleased with. In fact, we actually doubled quite a lot of our targets as well. And there were quite a few different factors that contributed to this success. Our members fed back that life coaching and positive goal setting were really a cornerstone of the programme. This helped staff to develop positive relationships with young people at their service. Another successful approach was being holistic in regards to health. In other words, intertwining mental well-being with physical health and healthy eating, and that helped the young people to understand how they were relevant and how they could all come together to impact their life as a whole. The really key thing for us actually was being flexible and having an emphasis on youth voice. Every young person is different, so you need to be able to listen to what they say and then adapt to what they're interested in. And I think because we did that and the staff of the programme did that, the young people really were engaged because they knew that they were being listened to. And I think that's why we saw such fantastic involvement with our social action projects at the end.
What did you achieve through Healthy Conversations?
We had really wonderful feedback from the staff that were involved in the programme. Both on a service level, it made an impact, and on the young people. So for the services, we found it helped boys in a number of ways. We were able to upskill the staff so that they were better able to support young people and better able to work within a health and wellbeing setting. We enabled foyers to try out a variety of approaches with regards to delivering health services. We facilitated new partnerships and connections with local organisations and decision makers through the programme. And we found it also created systems change with a lot of foyers adopting the ways of working from Healthy Conversations, advantage thinking and the paperwork. Really interestingly, a lot of the foyers were able to use their results in the programme to influence local commissioners and get more funding. So that was great. As for young people, we found that Healthy Conversations had a really wide range of personal benefits. We've got case studies of young people who reported improved relationships with families, securing employment, increased confidence, losing weight, giving up smoking. So that was really positive, and you name it, I think I've got a story about it. There were also a lot of stories about how this programme helped to improve relationships between young people and the local community, so there were beneficiaries that came from outside the foyer as well, which was great.
And anything finally to add to any of that?
Well, all in all, it's been a really successful and positive programme, and I think it's been a testament to how advantage thinking can make a real difference to young people's lives. I want to thank everyone who's been involved, obviously all the staff here at Foyer Federation, our partners who helped us to train the network, but most importantly, the thousands of staff and young people who helped to make Healthy Conversations a reality.